Hi everyone and welcome to Meridian Health Group. My name is Dr. Victoria Gamba, the resident obstetrician and gynecologist. And today, being October, it marks Breast Cancer Awareness Month, and that's why we are here. Globally, we know we lose around 7 women every day due to breast cancer, and that is why we are here, and we want to show you how to screen yourself for breast cancer to increase your breast awareness. So remember, this is not an alternative for mammography, for you to skip mammography. This is just an adjunct to help you to be more breast aware. So I will begin with 5 simple steps. Number 1, I want you to be able to know how to be breast aware. And that means you need to know how your normal breast looks like, how it feels like, and to be able to detect any changes when they come. So number 2, I want you to know when to do your breast exam. So this normally happens at least 5 to 10 days after the first day of your fast period, and it happens in the following simple steps. So the next 3 to 5 steps just involves how you're going to do your breast exam. So number 1, we need 2 things for you to look and feel. So number 1, as we're looking for the breast changes, so the first thing I would want you to do is either lift your hands, both of them, towards your head, like this, or you can put your hands akimbo, just around your waist, and this should be able to help you to see any changes in the shape, in the contour of your breast, and so that you can be able to now feel your breast for any changes. So the next step would be to examine your breast for any changes, and this one usually you can do it standing up like this, or sitting, or even lying down with probably one hand behind your head. So when you're checking either breast, you can decide which one to start with, but the main aspect is to use the palm of your hand, so the area between the fingertips and between the palm of your hand. So that is what you use it, and make sure you palpate until you feel the ribs. So you're looking for any breast lump or breast masses or any tenderness around the breast, or as you're looking, you're also looking for any skin changes around your breast, okay? So notably, there are different ways to examine, of course, but the usual clockwise or anti-clockwise is okay, as long as you don't miss any quadrant when you're doing your breast examination. So of course, when looking, you're looking for any redness, any tenderness, and also any skin or ulceration or erosions, or even the orange peel appearance that we call it the dimpling of the breast, okay? Then the next step would be you look at your nipple areola area. So it's the same step. You look for any changes around your nipples, around your areola area. The areola area is the area between the nipple and the breast, okay? So that is usually the black discolored area. So you can look for any skin dimpling around area, any pain, any ulcerations, and finally you can look for any retraction of the nipples and any discharge coming out from the nipples. So the final step would be you look at your armpits, and the armpits you do 5 areas where you need to check. So number 1, I'll show you using mine. You can just be standing or you can be lying down. So number 1, you look at the anterior aspect. You're looking for any changes, any pain, any lumps, and mostly these are lymph node swellings. So you can check on the anterior aspect, then the posterior aspect as you go behind. Then you can look laterally, this is towards your arm, and then medially towards your body. And then finally there's an apical one just at the edge of the triangle, at the tip of the triangle where your arm and your axilla meets. So that's where you check. So usually once you do all these 5 simple steps, the next thing is to know what is abnormal and then to escalate. So when you escalate, you go to your nearest health facility for now a clinical breast examination by either a physician, a gynecologist like us, and also maybe a breast surgeon can also help you on the way forward. So welcome to Meridian Health Group. We do offer free breast screening every day, and we hope to see you. Thank you.